Kelsey's going to tell us. Go ahead.
Okay, so today I'm going to talk about allergies in dogs. So first, what is an allergy? It's basically an overreaction of the immune system to a specific allergen. So this can be things like pollen, like how you get seasonal allergies in the spring or something like that. It's usually a protein, and it usually involves immunoglobulin E. And so the immunoglobulin binds to the allergen. And this picture here kind of shows what happens, but here's the allergens and here's the antibodies here. And then for the next time you're exposed to this allergen, you'll have these antibodies in here. And then they'll attach to this mast cell, which then is going to produce an allergy response. They're going to release histamines, which is going to cause like inflammation, things like that cause the response. And then exposure is what causes the sensitization. So you can't be allergic to something you've never been exposed to.
Okay, before you go on, yeah, let's review that. And I don't have a laser pointer here because mine don't work, but let me see. There it is. Okay. So the kicker is, notice it's a B cell initially. Okay? And those Y's on there are antibodies, and you might call these the B cell receptors. And then an allergen comes along, like pollen or dander. My advisor at Nebraska was allergic to rat dander. And we had over 1,000 rats in this one room, and he could not go near it. So then you get this binding, and she made a good point that you're not allergic the first time you get exposed to anything. But sometimes people don't know they've been exposed, so they might think it's the first time they get exposed and they react, but no, you've been exposed before, you just didn't realize it. So, you go down here, and this B cell becomes a plasma cell. So this is a pretty good little diagram. It's chock full of things. Once you differentiate to a plasma cell, you never go back. Remember that in immunology. If some cell differentiates to another cell, it's never going to go back and retro fix itself. So a plasma cell is committed now to making antibodies. So this cell is pumping out these antibodies, and they're always in a Y formation usually. And then it's critical that these are IgE. And it's kind of family related. People that are allergic then tend to pass that trait down to their offspring. And it's because they make too many of these. So somebody that's allergic makes a lot of IgE. Somebody that's not allergic doesn't make many of these. Because this is a weird antibody. It's one of the least present. Yes?
So with like anaphylactic shock, where like your throat closes,
Oh,
your
yeah.
tongue swells
Yeah.
up, is that just like the sensitivity, like the inflammation response?
Yeah, and that's this response here. Like you could be allergic to penicillin. If you ever go to a physician's office, and usually if you get any kind of injection, they don't let you go out the door right away. You have to sit there 10 minutes or so, because an anaphylactic reaction is what's called type 1 hypersensitivity. It gets deep, and it happens within minutes of the exposure. So yeah, that's anaphylactic. So anyway, these IgE antibodies are floating around, and it ends up being they have this propensity. Okay, so there's the mast cell. So you have this IgE plus a mast cell. Then you get this, where the antibodies have attached by the stem portion to this mast cell. Antibodies usually don't do that. They don't attach to anything usually by their stem, because we'll see that the two shorter arms are the antigen binding sites. So they do it for the B cell and they do it for the mast cell. But then the mast cell has histamine plus other chemicals. And when it says it's primed, that means there's a lot of IgE on the mast cell. You wouldn't get any allergy if there weren't any of those mast cells there. There's one thing the diagram's missing too, so we'll listen up. So then you've got this thing primed, like it's ready to release something. So then you get this re-exposure to the same antigen, and it's got to be the exact same antigen. And one thing I don't like about the diagram is they have this antigen fitting into that like little depressed part in the Y, and that's not true. They attach to the arms. Anyway, so that's one thing that's maybe not the best. See how I'm your partner, right, Kelsey? Okay. So that's not the best depiction. But the other thing is, this individual wouldn't have an allergic reaction the way they've drawn it. Because here's the thing that's missing. You have to have a lot of antibodies on the surface, and they have to be so close that when one antigen binds there, it binds to another antibody right next to it. And you get this, what's called cross-linking. You get an antigen that two antibodies are attaching to it. That's pulling the trigger. This would never be an allergic reaction. But if you have a lot of antibodies and one antigen sits there and works on, it fits one arm on one antibody and one on the other, that's a cross-link. That's the stimulus to release histamine. So anyway, but it's a great diagram overall, but it also shows you that there's a lot of things out there that maybe aren't complete or could be done better, and that's kind of like why you meet face to face, because if you just saw this, you may not realize that that's really not a true picture. You'd have to have a lot of antibodies, one right next to here, one right next to there, and this blue would have to branch across two, and if you get a lot of that branching, then you get a lot of histamine release. And of course, what's the antidote for this reaction? Antihistamine, you know, at least the histamine. There's other chemicals released. Back to you, kiddo.
So any dog can develop an allergy, but because it takes a longer time to become sensitized to a certain allergen, you don't get puppies that immediately have allergies. So most of them develop between 6 months and 2 years of age, with the exception of food allergies. Those seem like they can develop kind of at any time. They don't really have an average age that they develop. Then here's some possible allergens. Just like people, dogs can be allergic to pollen, dust, mold, different medications, certain kinds of shampoo, different perfumes they might be allergic to, meat, soy, wheat, different ingredients in their food.
And there you have that dander again.
And dander, there's been studies that dogs can be allergic to other dogs or cats or even people. They can be have an allergy to human dander. Alright, and then there's different types of allergies. So there are food allergies, contact allergies, which are the least common, insect bite allergies, and the most common one there would be a flea bite allergy, which they call a flea allergy dermatitis. And sometimes it's hard to diagnose because sometimes dogs will have more than one type of allergy, so it's hard to tell what's causing their reaction. I actually found something that said up to 30% of dogs with food allergies also have another type of environmental allergy. So inhalation allergies is the most common seasonal allergy, usually associated with different kinds of pollens. So in people, if you have a seasonal allergy, you usually get respiratory symptoms, you sneeze, runny nose, stuff like that. But in dogs, it usually manifests with skin symptoms. You can still have the respiratory symptoms that people do, but more commonly it's skin-related issues. So you can get itchy skin, red scab skin. Sometimes dogs will come in from outside and they'll rub their face on the carpet because it's itchy. If they scratch a lot, they can also get hair loss, and they can also have itchy ears or ear infections. Then this is a picture of a contact allergy. This happens when a dog comes in direct physical contact with something they're allergic to. It most commonly happens on their paws and their stomach because that's what's touching the ground most often. So this picture is an example of just like this red irritation on the dog's paws that can happen with allergies. It's usually associated with grass or any kind of pollen that settles on the ground, so something that they would be touching. And they'll often like come inside and chew their paws or lick them because they itch. Then there's food allergies, and they have a lot of the same symptoms as seasonal allergies, again, mostly skin problems. So it can be kind of hard to tell whether the dog has a food allergy or a seasonal allergy. They can sometimes have GI symptoms, vomiting or diarrhea, but again, skin problems too. So kind of one way to tell is to pay attention to the timing that the dog has the allergy. So if it's a year-round thing, then it's more than likely a food allergy, but if it just happens in the summer or just in the spring, then it's probably a seasonal allergy. You can also look at where the skin problem occurs. If it's like diffuse across the entire body, then that is more likely to be a more likely to be a food allergy, as opposed to if there's just itching in one small area, then that's more than likely a specific seasonal allergy. So some examples of common food allergens, again, eggs, meat, soy, corn, wheat, things like that. And how these are diagnosed. One example, this is an intradermal skin test. And each of these little spots is getting injected with a different kind of antigen. And so what they do with that, it's the same kind of thing they use for people. They inject a little bit of a different allergen and they wait and see if there's a response on the skin. So any irritation, redness, swelling, anything like that. And that can be used to find out exactly what it is that the dog is allergic to. You can also do an IgE blood test. So they'll draw blood from the dog. And then if there's a high, you can test the levels of IgE. If there's a high level of it in the blood, then that tells you the dog is likely allergic to something, but it doesn't necessarily tell you what it is. So once you know the dog has an allergy, then you can do specific IgE blood tests.
Would the high levels of IgE be noticed like at any point, or would it have to be like after or right before an allergic reaction, or?
I'm not 100% sure on that, but I think because you're always going to have those circulating, I think it would always be.
They'll always be there before, during, and after an allergic reaction. Because it sets you up for one. So let's say you got exposed somehow and you react to it, but if you never get exposed to it again, those antibodies are still there. They're ready to work, kind of like that one diagram where the re-exposure. So you never know, but they're going to be there. Like she said, they're not. You don't know what they're allergic to. It's just higher than normal, the level of IgE.
If you know they do have an allergy, though, there's specific tests that you can do still with the IgE, and you're just going to look for an antigen that binds to the specific antibody in the blood, and then that can tell you what the dog is allergic to. And then for food allergies, there's not really a certain test that you can do, so this is done more experimentally. The dog is usually given some kind of hypoallergenic diet, and they have things in it that the dogs likely haven't already been exposed to, so they wouldn't be allergic to it. So a lot of them, instead of using beef or chicken, they'll use duck or fish, or some of them even use kangaroo. So then they have to be on that diet for 12 weeks until all their symptoms go away. And then you can gradually reintroduce their old foods and try to see what it might be that's causing the reaction. So if you reintroduce a food and they're fine with it, then that's likely not what was causing the allergy. And you just have to go through a process like that to try to find whatever, the food that has whatever it was that they were allergic to, and then you'll have to avoid feeding that. Okay, and then treatment for food allergies. If it's something really simple, then it might just be avoiding that certain food and getting a specialized food that doesn't contain that ingredient. You can buy foods that don't have corn in them or that don't have wheat in them. If a dog's allergic to multiple things, the vet might suggest that you make your own dog food at home, home-cooked dog food. If your dog has flea allergies, which is sort of like if you have a mosquito bite allergy, all dogs are going to react to flea bites, but dogs with flea allergies, one flea can make them really itchy, so it's important that you prevent fleas. So any kind of topical or chewable that you give them to prevent fleas is helpful there. Then just like with people, you can give allergy shots, which it just injects a small amount of the antigen, and it kind of builds up immunity for the animal so that when they're exposed to it again, they won't have quite as drastic of a reaction. If your dog has seasonal allergies and they're getting contact allergies, like that picture of the feet, then regular bathing might help with that, just to remove any environmental antigens that are, or allergens that are on their fur or their feet. Or you can even, every time they come in, just kind of wash off the bottoms of their feet. You can give dogs Benadryl, different antihistamines, but this is better for a short-term thing, and it doesn't work on all dogs either. So it's normally just recommended for mild, very short-lived seasonal allergies, not for a long-term thing. And then in very extreme cases, you can get an immune-modifying drug so that the immune system no longer reacts so violently to the certain allergens. But again, that's only if the allergy is really bad. I think that's all I have.
Okay. It's a good topic. Yeah. Questions, comments? Here's one over here for you.
The immune modifying, is that anything related to like immunodepressant, or is it something different?
Yeah, it's basically just an immunodepressant, and it makes it
Immunosuppressants is the term.
Oh, yes.
I know what you meant, but I just want to make sure, yeah. Yeah, and that would be extreme, because then anytime an animal or person's on immunosuppressants, you're susceptible to other things. So that's kind of like the last resort. The one thing she did mention, I'll make it quick so we get our other two people in there, but you know how she said, go back to that slide where one of the treatments is to give the allergen, right? Allergy shots, build up immunity. Here's the thinking behind that. Remember, it's all, IgE is the only antibody that can do that to a mast cell. So if you slowly give whatever the animal is allergic to, and they do this with people too, you tend to get other antibodies, other classes of antibodies made against that allergen. And what happens then is you'll get more IgE or IgG that can recognize that allergen. And the thinking is, then when you're exposed to the allergen, a lot of the IgE doesn't see the allergen because it's taken up by IgG. See what I mean? You kind of like make other antibodies, not the IgE. And then so when you get exposed, since it's only IgE that can trigger that reaction, if a lot of IgG has been made because you've been pumping with antigen, you have a less response, maybe sometimes even eliminated.
I had like really severe dust and like grass and tree and pollen allergies. I think I did allergy shots for like 3 years, and now I don't even like to take any antihistamine or anything. So like it actually works.
Yeah, and so I think that's the current thinking. You pump the person or animal with a little bit of the antigen they're allergic to, and over time you build up another class of antibody like IgG. And so then when the person doesn't get exposed, a lot of the allergen is taken up by IgG, and there's no problem with that. It can't make that reaction, so that's pretty neat. And they're doing that they're finding out with kids, if you give them a little peanut butter over time, don't quote me on this, but there's some studies now that
They won't have the same response.
they won't have a
Yeah.
peanut allergy ever, because it's the same kind of thing. You're pumping them a little bit. I think it's even people that have peanut allergies. Yeah, because I remember that seeing some report on that. Let's say you have somebody with a terrible peanut allergy, you know it's IgE. So what you do is you pump them with a little, in a controlled medical setting, some peanut butter, and then more peanut butter later, and you're going to build up IgG. Yes. Okay, we need to move on.